Congratulations on your new addition to the family.
Here are a few guidelines to make sure all goes well.
Self-care. The bond between you and your baby is very special. Taking care of yourself is important for your ability to bond with and take care of your baby. Getting rest is hard when you have a new baby. Try to sleep when the baby sleeps and let family or friends help you.
Sleep position. The safest place for the baby to sleep is in a crib or bassinet in your room, but not in your bed. Your baby should sleep on her back to reduce the chance of SIDS, sudden infant death syndrome. When your baby is awake, you should give your baby some time on her stomach several times a day. This helps with arm and neck strength and reduces the chances of getting a flat head in the back. Car seats. Car seats are important when you have a baby in the car. It should be facing backward in the back seat of the car. Make sure the baby is always fully strapped in while in the carrier. And remember, never leave the baby alone in the car. Breastfeeding. Breastfeeding is the best nutrition for your baby. Most babies only need breast milk and usually do not need any formula. Breast milk helps prevent infections, helps with brain development, and seems to reduce the risk of obesity later in life. If you need help with breastfeeding or a breast pump, let us know.
Vitamin D. Breast milk is better than formula for many reasons, but it is a bit low in vitamin D. So for babies who are mostly breastfeeding, we recommend taking a vitamin to give enough vitamin D. Vitamin D is important for bone growth, and some studies show it may also help the immune system. The amount of vitamin D to give depends on which vitamin you buy, so follow the instructions on the package or ask us if you have questions. Jaundice. Jaundice is a yellow color that babies can get in their eyes, skin, and mouths. A little bit of jaundice is very common and does not cause any problems, but too much can cause damage to a baby's brain. If you notice that your baby is looking more yellow, then your baby needs to be seen at the clinic or the emergency room if the clinic is closed. Fever. Make sure you have a thermometer so you can take your baby's temperature. You should take your baby's temperature rectally. Ask us if you don't know how. If your baby is less than 2 months old and has a temperature of 100.4 or higher, he or she needs to be seen at the emergency room. And remember, do not give Tylenol, also called acetaminophen, to a baby less than 2 months old. Newborn noises. Hiccups, sneezes, mild nasal congestion, stomach grumbling, and a little spitting up are normal for newborn babies. You do not need to do anything about these. If your baby has forceful and frequent vomiting, he or she needs to be seen.
Newborn discharge. It is normal for newborn baby girls to have a clear or milky white vaginal discharge, sometimes with blood mixed in. This is caused by effects from the mother's hormones. It will go away on its own by about 10 days old, usually sooner. We hope this helps. Remember, every child is an individual and develops at his or her own rate. There is a range of normal in developmental stages.
If you have any questions, please ask your healthcare provider. And once again, congratulations on your new family member.